I feel very fortunate to have the opportunity to work as National Clinical Director for Respiratory. The responsibility here is to think how NHS England can most effectively advocate and deliver improvement for people living with lung disease. At the moment, there are quite stark health inequalities that exist in outcomes in England for people, say, suffering from common diseases like asthma and COPD. And our programmes are specifically thinking about how we can improve outcomes for those living in our least well-served communities, either when thinking about how much they're able to spend their adult time well, how we can impact upon life expectancy, and how we can support people to keep well and out of hospital when they face crises in winter. For me, working at the Heart and Lung Research Institute has been an absolute privilege. There's a combination of a really appealing and physical environment where people come into work and have really good conversations about the work they undertake. And that's in the context of multi-professional teams and researchers working across disease areas, from basic science to epidemiology to very applied clinical research. So we're particularly interested in people's decision to take up a very effective treatment for chronic lung disease called pulmonary rehabilitation, where a great number of people, when offered to have this treatment, choose not to attend. So my work is very applied. It's about thinking about how people might more equitably get the benefit from being involved in research and being able to access clinical care. And so much of the work that goes on here is innovating at a very early stage, thinking about new approaches to treatment or potential transformative interventions. And I think what needs to happen is, when developing those innovations, you need to think about the communities you work with in order to understand their impact, and then eventually what you want to see is that they play out equitably and fairly in the people who are affected by the diseases you're trying to treat.